Hello, good evening, everyone. Is it audible? Is my voice audible? Yes, thank you. So, good evening, everyone. A very warm welcome to all of you for today's fourth session of our Clinical Mastery series. We had an incredible journey through the previous sessions filled with deep insights and meaningful clinical understanding. And today, we step into this final session. So, today is the final session. So it's all about taking our learning to the next level and integrating everything we have explored so far. So today is the last one. So this session is going to be equally powerful and enriching. Okay. So I want all the doctors to be interactive as they were in previous sessions. So surely we'll take back a valuable clinical pearls today and we can directly apply these rubrics in your clinical practice. So let's make the most of this final session very meaningful. Let's begin. So the topic of today is understanding the self-devaluation related rubrics in repertory. So we have come into the final session. We have done 4 sessions. If you have not attended doctors, please go back to your our YouTube channel and you can see all the videos throughout. Okay. Before starting the session, I would like to give gratitude to Dr. Samuel Hahnemann and Dr. Praful Vijayakar sir, because of which we are in the system today and able to see the miracles of cure. Because of his understanding, we are able to apply that logical, mathematical homeopathic today. Okay. Today's chief guest is Dr. Pavitra ma'am. I am grateful to her, and we are all grateful for her teachings on everyday Wednesday sessions. I warmly welcome you, ma'am, for today's session. So, I would like to take a couple of minutes to share something very important with all of you. So we are planning to start a Metra Medica Mastery series, okay, which will be conducted eight Sundays. Okay, so this series will be taken by Dr. Pavitra ma'am, Dr. Shreyans and myself, and all the focus will be more on not just learning the symptoms of Metra Medica, but truly understanding the remedy. In this series, we'll be covering most important remedies in a very unique and practical way, where you will be able to understand the tri-miasmatic journey of each remedy, clearly connect its mind and body pathology, also work with the rubrics in the clinical way. So these are the understanding how the Metra Medica series, mastery series will go on. And most importantly, we'll be able to apply confidently in the clinical practice. In your practice, you will be able to apply very beautifully. So this is designed for both students and practitioners who wants more clarity and confidence in their prescriptions. Each session will be deep, case oriented, and clinically relevant. So, whatever you learn, it will surely stay with you. The sessions will be conducted on Sundays and recordings will also be provided. So, don't miss anything. So, you won't miss anything if you're not able to attend it live, you can go back to the recordings given. So, regarding the registrations, the early bird registration will be 1,299 till 20th May. After that, it will be 1/5 till 5th June. Okay. 1,499, it will be after the 20th May. So till 5th June, the registration will be open. After 5th June, the registration will be closed. So the sessions of Metra Medica Mastery Series will begin from June 7th. So the detailed poster, what all will be covered, what remedies, everything will be shared in the WhatsApp group of our Bhavani Homeopathy Learning Academy. And Dr. Pavitra ma'am will be sharing you few insights about this workshop. Yes, ma'am. Over to you.
Good evening, everyone.
Good evening.
So we have come up with an exciting new series, Metra Medica Mastery Series. So as Padmini beautifully explained, so we'll be discussing different aspect of the remedy. I will be discussing how to understand the remedy from the repertorial language, because we keep talking about reverse repetization. We keep talking about how we learn from the repertorial language. That is where I will be focusing with the cases. Okay, so hope it will be very useful to register. It will be very, very useful, and we are trying a different way of getting to the drug picture. There's a different way in understanding a remedy, and I think it will be much more practical in understanding using the repertorial language. And many times, trust me, many cases get solved, and I will try to explain few rubric and the practical applicability of the rubric. So thank you so much. So register soon, avail the early bird offer. Thank you so much.
Thank you, ma'am. So as I mentioned, the detailed poster will be shared in the group. So as you all know, myself, Dr. Padmini, has completed BHMS and SCPH. Currently working in Bhavani Homeopathic Clinic in Bangalore. So we'll go to today's topic. So everybody knows today's topic, right? So what is self-devaluation? I think my voice is audible. Okay. So today the topic is self-devaluation. So before understanding the self-devaluation journey of that, what is it? What does it mean when the patient says, I'm not good enough? Yeah, we'll start with the interactive session before actually going into the topic. Yes, doctors, what all you have an understanding about self-devaluation? What does it mean when the patient comes and says, I'm not good enough? I'm not good. I'm not, skillful. I'm not great. I want all your inputs, doctor. We can make the session interactive. We can learn together.
Low confidence.
Yes. Okay. Is it only low confidence? Is it only
Low,
okay, degrading himself? Low confidence, self doubt. I feel I am capable to do this. I am low to do. Yeah. Trust issues, inferiority. Mm. What else? What else comes under self devaluation? What is that thought? Before understanding self devaluation, we'll understand what is value, self devaluation. So, what is the key word here is value. So, what do you mean by value? Value means the worth of something. Okay. So, value is not just one dimensional, it is a multi-dimensional. So, there are different facets of value. We have material value, functional value, social value, emotional value, self perceived value. So, we know all this have a different facets. So, when it comes to material value, we all know it could be a car, a phone, a house, each has a price tag, right? So that is a material value. So if anything gets damaged, the value of that price decreases. A car get damaged, a phone getting damaged, the value or a resale price or the price drops. We know, right? That goes on decreasing. Functional value. For example, a person's role. Example, a doctor heals, a teacher teaches. So if they are not able to do their role properly in colleges or in any government sectors, they are not able to treat patients. So that their functional value goes down. Okay, they feel they are not performing well. So that value drops in that function. Second, third is social value. Social means what? In society, how I am respected, how I have a value in the society, how people see me, how is my position, recognition, the status in the society. That is the social value. These are the facets which will make you understand during case taking what aspect of value in the patient gets affected. An emotional value. What is the emotional value? For example, a person feels I'm not loved, or do I matter to this person? Do the parents consider me as a third kid, or they neglected me as a third kid? That is an emotional value. The last one is self perceived value, which is very very important. What is self perceived value is what does the person think about himself? What do I think about myself? What is me? What am I? That is a self perceived value. That is a thought process. It's an independent of reality. So reality, however it is, how the person thinks of himself is what the self perceived value, which we are going to understand deeply in this session. So entire session will be handling this self perceived value. Okay. So what is self devaluation? Before that, what is devaluation? Devaluation means it's a loss or reduction of value. So it's not just a loss, it's a perceived fall from what one should have been. I hope you are understanding. So what is it? So a person who's scoring 60%, a student, okay, if she expected 40% and she gets 60%, she will never feel low. She will never feel invalued. She will be more happier. But if a person or a student expects 95% in the exam and then scores less than that, say 60%, so what she feels? She feels I'm worthless. I'm not able to score. Why did I? I'm not capable enough. So that is the devaluation feeling. So devaluation is not absolute. It is relative to expectation and comparison. So only when you have an expectation, when you compare with somebody, that is when this conflict trigger arises. Otherwise, the person will not have a sensitivity towards the devaluation. I hope you are understanding. Okay, so the two aspect is very important. That is expectation and comparison. These are the two elements which we need to understand. The patient is sensitive to that. Coming to the self-devaluation, understand. Self-devaluation means when a person becomes both the judge and the victim. Okay, what is the meaning of judge and the victim? The judges, you are able to understand that the, the person feels nobody is telling that I am a loser, I am worthless, but he himself judges that I am unworthy, I am good for nothing. That is the person have in his mind about himself. He becomes his own victim. So there is no external person who is telling them that you are not worthy. It is a self feeling that I am useless, I am inferior, I am failure. So nobody needs to say anything anymore. So the whatever the external voice which has to be there, it is eternal. So person if he is internally itself, nobody is telling them. How does this journey goes? Why does the person feel himself is not worthy, right? So there is a journey for that. This journey usually begins in the childhood. It is not sudden. Self-development cannot be a sudden. It has to be in the history. So in the history, you have to understand in childhood, there will be a lot of, child making a mistake. Anything children, tries making a mistake. Instead of getting the support or correcting them in a good way and teaching them, they will be criticized. A lot of correction in a way which has to not be done in that manner. Also because of self-doubt of being always compared, put down by others. For example, a mother tells to the son, see the other door kid. He is very smart. He looks, better. He dresses, he keeps his things neatly, but you break things. Constant comparison also in studies. This can make the person feel self-doubt regarding his own way of behavior. So this gradual formation of self-devaluation have impact on the child from all the factors in the childhood, from parents, teachers, peers. This emotional impact will be felt by the child in form of hurt, shame, fear. because of which the child feels maybe they are right, because it's been constant by everybody, parents, teachers, friends. Everyone puts him down, and at one point of, you know, uh, point, he feels they are only right. The body accepts it. Subconsciously, the body accepts that they are right. This repeats, the same message repeats again and again, and this forms into a strong belief. It has imprinted, the soil has imprinted that I am not good enough. Completely, there will be identity transformation where the person feels, can I, wait, madam? So the person, the identity itself questions, who am I? Am I really worth it? So this gets imprinted because of the childhood impact, a trauma, a childhood, maybe the toxic parenting, toxic school, toxic friends. All these will be a soil for becoming self-devaluation. So I am not good enough. I am failed. I am less than other. These are the few words which are expressed by the patient in clinic, or it could be in any disease which they have this delusion, or they have that feeling I'm not worth enough. So this is very important. Whenever the patient in your clinic says all these words, don't neglect it. We can understand this while they are saying about self-devaluation. In the previous sessions, we explained regarding domination and abuse. Dr. Shaz has explained about lacanine. I will explain you again, but Dr. Shaz has told about how the abuse happens. Even in carcinosin, there is severe domination, right? So in the domination, what happens is always they are put down. So that is also becomes a soil for self-devaluation in the later stages. Even abuse, verbal abuse and emotional abuse, all these are going to have a soil for self-devaluation. Okay. Self-devaluation through the lens of German new medicine. If a person feels I'm not good enough, so where does the body express it? Okay. So, yeah. Doctors, what do you think? Where will be the organ affected in self-devaluation? What are the organs affected? I mean, which body pathology you can see? Bones. Okay. Only bones? Only bones? Hmm?
Blood.
Yeah. Joints. Mesoderm derived organs. What are the mesoderm derived organs? Ligaments. Very good. Yeah. What are the mesoderm derived organs? Only bones, joints, ligaments? Bone marrow, platelet. Bone marrow. Okay, muscles. Correct. Cartilages. Very good. All are right. Yeah. So as everyone rightly told, the mesoderm. So which is old mesoderm or new mesoderm? Which mesoderm is the part? Which mesoderm gets affected here? Old or new mesoderm? There are two mesoderms, right? Yeah. Which mesoderm gets affected in self-devaluation? Old mesoderm, right? Old mesoderm. Is it old mesoderm, doctor? What is the
Mesoderm.
conflict of old mesoderm? Yeah.
New mesoderm.
Yes, correct. New mesoderm. What is the conflict of old mesoderm?
Attack conflict.
Yes, correct. Protection, attack, conflict. Very nice. So if you're not having a clarity about GNM, Visodam, we go back to our Bhavani Homeo Learning Academy YouTube channel. We have given the GNM understanding of all the layers. Okay, so please go through it. You will have a clarity, because you will have an understanding how to take the case also. It's a tool to case taking. So as rightly said, it is a new mesodome, not a old mesodome. Okay, self-devaluation affects new mesodome. Because everyone rightly told it, it is a framework of the body which gets affected, right? So what are the comes in framework? Connective tissues, muscles, joints. then ligaments, cartilages, then bones, joints. These are the framework of the body which gets affected. The new mesoderm has structure and support organs. Remember that. New mesoderm is for structure and support. So these give rise to bones, joints, as I told you, ligaments, muscles, all are needing a support or structure. So basically the framework of the body. Self-devaluation affects the structures which defines the strength and support. Support and strength. These are the two keywords. Whenever self-devaluation case or any case comes where the support or strength is lost in the patient, any organ related to that, go back and ask their self-devaluation. Okay, this is the key. When a person feels I'm weak, I'm not capable, I'm not supported, they will not come and tell you directly. You have to understand in case taking the situations in their life. Okay, the body will respond in the joints. Why these organs? Why the organs of joints are affected? Why these organs? Yeah, why these organs are affected? It could be any other organ, right? Anything else, doctor? Why these organs are affected? Your understanding? What does it represent? These joints, whatever you told, what does it represent? Only support or strength? Anything else? Any other function?
Relationship of the family.
Yeah, relationship.
Relationship.
Yeah. Then, apart from relationship,
As well as stability,
yes, stability,
balance, balance,
balance. Yeah. Movements, very nice.
budget.
Mhm. Then, it's in the slide itself. Ma'am also rightly pointed. It's stability, strength, identity, support. Even movements, yeah, the function is movements. The structural system reflects it. So whenever there is sense of self collapses, these are the things which are need to be taken care of. In self-devaluation, there are two types. Under this, you have two types, that is generalized self-devaluation and localized self-devaluation. Can anybody quickly tell me what is the difference? What is the understanding of both? Yes, generalized and localized. Why there is both? Anybody? Responsibility. Yeah, all that are other facets, but why the joints are affected? Hmm. General Generalized self-devaluation means yes,
That is, they are affecting the autoimmune disease or come under this generalized devaluation because it
yes,
affecting the mind as well as emotions
yes,
and
correct.
health devaluation. Localized is affecting these joints as
Yeah,
well as bones as well as
yes.
in organ parts.
Yes, correct, doctor. Very rightly said. As ma'am told, generalized self-devaluation can go into an autoimmunity. Local it also can go into autoimmunity, but more of we can see in particular organs which are affected based on the conflict. Okay. So the type of conflict decides the location. Remember that. For example, we'll go with the central self-devaluation. Thoracic and lumbar spine. When does it get affected? Given in an example, when a person feels, I am nothing, I am worthless, I am humiliated. Okay, usually after any public humiliation, repeated degradation, loss of dignity in any workplace or the home, work friend, within company, whenever there is this humiliation or degradation, the identity, the dignity is lost, and the person also feels that I am worthless. Wherever this situation is there, directly we can see the clinical expression in the lower back, chronic back pain, not lower back, the back pain. Okay, vertebral degeneration, disc issues, postural weakness. Whenever you have such cases, do go back to the case history and ask the repeated identity loss or dignity loss in the company, anything put down, humiliation, all that. In lower back, whenever the lower back is there, remember there is no support. Ask where the support is not given, where the patient needed the support. Patient should feel, the person feels, nobody has my back. I'm alone in this. I can't rely on anybody. It could be family not supporting, a wife who is want to work or want to do something in life has no back. So there will be many cases in clinic actually menopause females, they have the desire to do something in life. They come and tell, I don't have support. My husband doesn't support me. He doesn't support me in anything. I'm all alone. And whenever we see the complaints, always we can see lower back pain and also the degeneration, all that. So whenever you have such cases, do think of support, partner withdrawal, workplace betrayal. Clinically, we can see lower back pain, lumbar stiffness, recurrent strain. These are the understanding. The last before one is pelvis. These are organs. Whenever these organs are affected, think of sexual self-devaluation. Pelvis and pubic bone, especially in females. Even in males, they say that I am not adequate as a man or a woman. They don't directly tell you, but when you ask, probe the sexual history, you will understand. I'm not performing, I'm rejected. Or if you ask the opposite sex, if you ask the wife regarding the husband's sexual activity, she will tell you. Not everyone encounters or confronts everything. So you have to understand regarding erectile dysfunction, partner rejection, infertility, miscarriage, repeated miscarriage, discovering infidelity, prostate related issue, urinary incontinence. These are the sexual self-devaluation. So this affected area will be pelvis, pubic bone, surrounding structure. Wherever you have this organs affected, do go and probe the self-devaluation section. The coccyx and sacrum. Whenever this organ or part of body is affected, do think about again the base support. The base support means a basic support which all human beings need, the base support, the stability, the grounding of the patient, the person's grounding. For example, the person was dependent on father completely for the finance, for the support, the base ground. After losing the father, okay, there is no support. So such incidents can cause the coccyx and lower backache, tailbone pain, sacral stiffness, sitting discomfort. When the person feels deeply unsafe, feels unsupported at base level, the organs are affected. Coccyx also tells about shit conflict. Okay, whenever the patient feels like a shit or anything related to anal disorders, we can think of coccyx shit conflict. Also, even it covers shit conflict. This is the conflict theme. Spine, thorax, and lumbar. Whenever we have an affinity, go with central self-devaluation, ask them. The feeling could be worthless. This is the understanding. It need not be same because each individual perception, the understanding, false perception is different, right? So these are a general understanding. Lower back pain, there could be lack of support. No one has my back. Pelvis pubis is sexual performance. I am not adequate as a male or a female. Coccyx or sacrum, it's a foundational insecurity. I am not stable or supported in any way. Okay. Any doubt in this? Any doubt, doctors? You have? Anybody who wants to add the point in this previous slides? Yeah, ma'am. Yeah, ma'am. Yes, ma'am.
I'm here again. Okay. So
Yeah.
she beautifully explained how, this slide, please retain the slide. She
Yes,
explained
ma'am.
about that spine, no, spine, thoracic,
Yeah.
the worthlessness. That's like the last slide. So
Okay.
see, we have this conflict, right? So yes, you have to go according to it. And sometimes the patient might feel worthless for a different reason. It may not be worthless for you. You might feel it is so silly. Oh, who the hell will feel so worthless for this? But it is a sensitivity of the patient. This is the guidelines. What in German you might say is a guidelines. I attended Vigil ma'am session. She said most of the time, 90%, whatever conflict is given, it will cover. But sometimes it may not cover. Don't force fit your conflict. That is bringing your delusion into it. So that point of view, whatever the patient says, that you take. Where the patient feels worthless, it may be very less, very belittling for you, but it will be more important for the patient. This is what I wanted to add. Okay. And even in sacrum, right, you can also think when the person is trying to balance. You say that I'm not stable, it can be I'm trying to balance. That can also be one of the input there. Okay.
Yeah.
Thank you.
Thank you, ma'am. Trimasphatic journey of self-devaluation related rubrics. So how does this self-devaluation go from SORA, psychosis, and syphilis? We will be understanding this upcoming slides. Before that, I want all the doctors, we know many self-devaluation rubrics, right? And self-devaluation emotions told by the patient. Even Pavitra ma'am added many points right now. So please give your understanding how this SORA, psychosis, syphilis of self-devaluation. What are the rubrics which you can see and understand how we can put up in SORA, psychosis, and syphilis? How can you categorize the self-devaluation, doctors? Any rubrics which you can give in SORA? SORA. First, we'll go with the SORA, doctors. So, from SORA, what are the self-devaluation rubrics we have in our repertory? Yeah, I want all the doctors to give an input. You can even text me in the chat box. Yes. Appreciation desires. Okay. Is it SORA, doctor? Is it SORA? What all comes after appreciation desires? In SORA itself. पेशेंट को पैरालिसिस हो एंड पेशेंट वन साइड झुक जाता है, फिर वो पेशेंट भी सेल्फ डिवालेशन में हो सकता है. यस, यस, हो सकता है. Yeah, even in cancer cases, paralysis cases, the patient loses some part of the limb. For example, even in old age cases, in young, the person will be able to run. An athlete, or like a person, becomes old, and after that, he will not be able to perform or catch a bus or run behind something behind the child. So he feels, I have become weak. This is all self-devaluation. Yeah, anticipation, ma'am. Yeah, yeah. Doctors, anything else? Yeah. Only appreciation, only appreciation is there. Confidence want off. Yes, very nice. Yeah. In SORA, we have self-devaluation, confidence want off. So there are many rubrics in repertory, no? Do we directly go to some worthless or useless feeling? But we have the lower rubrics, no? Reproaches. That is also very high. What about SORA? Soric self-devaluation.
Timidity as
Yeah.
well as confidence, want of self-confidence, and introverted people.
Yes.
They are
Yes.
so slow self-esteem,
Yes.
low self-esteem.
Yes. So the soil begins from the SORA, right? So as ma'am also rightly told, and many doctors have put, we have confidence want of. Initially, for person, before getting into the reproach or going into the worthless feeling, initially there will be soric self-devaluation. That is confidence want of or support desires, undertakes nothing, business unfit for, anxiety success, honor or absent sense of. So these are the soric self-devaluation. Even many doctors have put here anxiety, irritability, anger, but they have to self-devaluation. There is need of self-devaluation. These are emotions. So confidence want of is a self-devaluation in SORA. Then it goes into the psychosis. In psychosis, from the want of confidence, from the anxiety, succeeds never. We have many rubric, I think. Undertakes nothing, succeeds never. Okay, then business unfit for. From there, the body goes into psychosis. Even the mind goes into psychotic self-devaluation. That is fear of failure, unfortunate feels, delusion, ugly, the legs cut off, despised, disgraced. These are psychosyphilitic self-devaluation. Okay. So when the journey goes, even the rubrics and the thought process changes. So that when it goes into psychosyphilis, delusion not appreciated, worthless, succeeds never. Then reproaching self, remorse, criminal he's, duty neglected. Then death desire, suicidal. So directly the self-devaluation will never go into death desire and suicidal because of the repeated patterns. repeated trauma, and repeated failure, even after so much of uh, trying, so much of doing in life, doing hard work, then even after that the patient undergoes failure in life. That is when these rubrics come into the action. The patient also goes into syphilis from the surah. This is the journey of self-devaluation. You can take a photo. You will have an understanding when to take the rubrics. So it's understanding self-evaluation related rubrics in the repertoire. Okay. So one by one, let us understand what is the core meaning of the rubrics. Okay. So what are the clinical scenarios we deal every day in clinic? How to take such rubrics? Okay. So first rubric is confidence lack, want of self. So what do you mean by confidence? In the initial starting of this session, doctors told no low confidence, right? So there will be not only low confidence, there will be uncertainty. There will be no certainty, inner certainty about oneself. There will be lacking that. It is a feeling that I can handle this, I am capable, I will manage. But with confidence there is also want of lack of this confidence. They feel they can do it, but they lack the courage to do it. There is an absence of the courage, there is no courage. So want of meaning is, it's very important to clarify. Want is lack or absence. So this rubric is not about low confidence. It is about the state where confidence is missing from within. They have the knowledge. They have the knowledge, but they are unable to prescribe in the clinic. This is want of confidence. Okay. So confidence lack want of self is the state where a person lacks inner certainty, as I told, about themselves. They don't trust their ability, their decisions, performance, and their worth. This is the main core understanding. Okay. How does this confidence lack of want of self-confidence develops? How this develops? In psychologically, because of repeated criticism and comparing with others, parents comparing, teachers comparing, and lack of encouragement. They don't have an encouragement because of being comparing. And after that, being not encouraged, they have that fear of making mistakes. And then, because of having a fear of mistakes, they go into the self doubt, external doubt. And this journey repeatedly happens, and because of which they land into lack of self-confidence. We see many remedies like silesia, lycopodium, in Metamedica and all. So directly we can't say there is lack of confidence directly, because the journey of the remedy has passed down 3 stages. And when you understand the remedy in SORA psychosis syphilis, this has been there in all the remedy, whichever has mentioned lack of self-confidence. So, doctors, what are the clinical scenarios we see? When to take this confidence lack, what of self confidence? When to take this rubric in the case? Any one example? When to take this? Yeah, anybody? Any clinical cases which you have taken this rubric? Confidence lack of, what of self confidence? Fear of performance. Yeah, yeah, correct. Yes, yeah. Fear of performance, examination. Yeah. Then, so we all have undergone this situation, I think. In schools, many students will be there who are, having a lot of knowledge, but they don't answer in the class. They have a lot of knowledge, they do score well, they write exam well and they score well, but they don't answer in the class. So this is a common clinical scenario, right? The person or a student will not be able to answer. Why? They know that the right answer, but they're not able to answer. So we can see these kind of students. The students knows the answer, still hesitates to speak, thinks that what if I am wrong? A professional life. Yeah, fear of stage, daring, indecisive. Okay. So professional life, we all see a capable doctor avoid taking responsibility. They are capable, but still keeps on checking unnecessarily. So they don't trust their judgment. Social position, we can see. Fear is not coming under psychotic doctor. Fear is coming under psychosis. Fear is under psychosis. Fear is under psychosis. Anxiety is Sora. Fear is psychosis. Yeah. Anxiety can be sourcephalytic. Yeah, ma'am. Yeah, ma'am.
See, as Dr. Padmini said, fear is psychosis. When uncontrolled and becomes panic, it goes to psychosyphilitic. Complete panic and delirious state will be transsyphilitic. Anxiety is soric.
Yes.
Stage fear can be soric, but it is like, see, it depends. If soric, I just want to go on stage, just a fear, very good anxiety, it will be stage fright, soric. But if it is feeling, they are having developing a false perception, the other person is going to laugh at me. Other
Yes.
person is going to ridicule me.
Mockery.
Delusion
Yes.
laughter, delusion ridiculed me. Then it becomes psychosis. Fever
Yes.
before exams, it's an anticipate. Fever before exams can happen because out of anticipation. Yes, you are right. It is an anxiety only.
It's an
That is what
anxiety.
something. See, it's
Yeah.
how it don't fix any particular rubric has a particular miasm only. It is what qualifies it determines the miasm.
Even
Okay.
the situation qualifies it, ma'am. Yeah.
Yes, exactly. You're absolutely right. So clear, Dr. Nitya? Yes. Okay.
So even it depends on the situation. So it's a
Situation.
general situations which I am quoting here. So if the situation even goes into sorosyphilitic, we can think about such rubrics. Okay. Yeah, social position. Yeah, as I was telling about social position, avoid speaking in the groups. They don't talk in the groups. Like for example, they think what will others think about me if I talk about money here in front of everyone? What about my social position? All these are facets of the confidence lack of. Okay, even in relationship they feel I'm inferior to my partner. My partner, I'm not great enough with my partner. So the constantly the girl seeks reassurance. You love me, will you be with me? So these are the confidence lack. They don't have the confidence. The patient expressions are all these. Can go through it. I keep doubting myself. I feel I'm making mistakes. These are the understanding. These are few words which are we see already in clinic. These are the words which patient usually tells. Even for small things, they feel nervous. These are the words of the patient. I'm not capable, I'm less. Okay. Okay. The next rubric, am I clear, doctor? Confidence lack of. We'll go to the next rubric. The next rubric is delusion, she is criticized. What does it mean, delusion, she is criticized? It's a fixed, false belief that the person experiences reality even if it's not objectively true. Okay. So the person does not say, the person who feels criticized, they does not say maybe they are criticizing. They will surely tell you, yes, they are criticizing. They are finding fault in me. They always tell something, brag about me. They say something, whatever I do, doctor, they have something to say. They have something to say. That is the words what is told by people, patients. Okay. So they feel that uh, it's not just imagination. So it's not doubt or a suspicion. They are very convinced. It's a conviction that they are criticizing me. Then only you can take this delusion criticize. Otherwise, this rubric is not be cannot be taken. Okay. So it's judged. It's being judged, evaluated negatively, or spoken about in disapproving way. Whenever the patients say, whatever I do, they talk negative. They talk in a very disapproving way. That is when this rubric can be considered. So it's not based on reality, it's just an exaggerated. They feel they are being always criticized. Okay, they are convinced. They are convinced. They are speaking ill about them. Inside, they feel I'm not good enough. People will find faults in me. I will be exposed. So whenever there is criticism feel, the mind becomes hyper alert, over interpreting and defensive. So that they should not be criticized. Oh, I hope you understand. Just to not get criticized, the mind goes into hyper alert so that I do things perfectly. So that I should, be proper. They should not tell me anything. Okay. So how does this develop? How does this delusion criticize develop? Initially, there will be lot of insecurity. Okay. So initially, how the patient or the person feels is deep lack of self confidence, constant internal questioning. What do they think about me? So this is first thought which person feels. After that, there is excessive vulnerability. Extremely, they are sensitive to remarks. Even a small comment feels like a big attack. A simple sentence is experienced as insult, humiliation. This is how the journey goes. Initially, the insecurity will be less, it's very less. But later, it goes into delusion with its vulnerability, with constant questioning. What do they think? Okay, even small offense words they'll think it as a big, big attack. Then goes into an isolation. Why they go into isolation? Because they don't want people to criticize them. They don't want people to talk about them, comment regarding them. Okay, so they go into withdrawal, isolation. So not because they don't like. You should always ask, do you like crowd gathering places? Do you mingle with people? In case taking, we ask no. So why do we ask? Because of this understanding. Okay. They want to escape the situation. Okay. Again, in criticism, Dr. Ambisa said if someone feels a person is blamed or put down, again and again, use delusion criticized. Okay. One more scenario where we can think this rubric. Very nice. Yeah, ma'am. Actually, actually asking your input after delusion despise. Fine, we will anyway differentiate delusion, criticize, and despise. Okay, and you can give your input, doctors, if you have taken such rubrics in your clinic. In clinical scenarios, we can see people, someone laughs in the group. Delusion criticized, someone laughs in the group, they feel criticized. Patient feels they're laughing at me. Delusion laughed at. Paraita Kavya, many remedies. So such rubrics can be thought of. What patient should feel. So it should say that words. We cannot take such delusions. They have to tell these words. Otherwise, you cannot take these delusions. So patient expressions are people are always judging me. I feel everyone is noticing my mistakes. Even if someone says something bad, I feel very even small thing they say, I feel very bad. I think others are talking behind my back. I don't like being around people. These are the words which can be, you can see how patients are expressing. So delusion criticized, we have many remedies here. Okay. So we have Baratakar, carcinosinum, germanium, hyoscyamus, plumbum, palladium, okay, lachesis, all this, and ignitia. Okay. So anybody can differentiate how Baraita Khan feels she is criticized, delusion she is criticized. Anybody? In short, will not take a lot of Metamedica, but in short we can differentiate. Anybody, doctors? You want to add any remedy? How they go have the feeling of delusion criticized? Any remedy in that you can give a light. How does Parataka, how does, yeah, carcinosinum, yeah. I think last to last session, I only told this rubric. Why do they feel criticized? Yes, this you have to answer, doctors, because everyone has attended it. I hope you have understood also. People are after why they feel loved, why they feel criticized, why Parataka feels. Okay. So in carcinosinum, as I explained, in carcinosin, they are perfectionist, right? They do everything in proper way. So if they don't do it, they feel there will be disapproval. They will not be accepted. They're very mild people. So they mold, they're malleable. So they will do work so that they should not be criticized or be hurt. So they feel there will be a lot of criticism. Delusion, she is criticized. Even in Baraita car, people are laughing at me. So they feel childish, they feel inadequate, they feel they are being judged. Even they feel somebody is talking about me. That is all thought process what Barata Khan has. Okay. In Ignitia, we can see silently they are suffering. Also, because of the hurt, they feel criticized. A loud one making them hurt, they feel criticized. Even in lachesis, we can see they feel targeted, criticized, and often they feel, they have been always targeted, have been always conspired, and with intensity, they feel that criticism. Even in Palladium, because of the need of appreciation, there will be not appreciation, so they feel hurt when they are not valued. Like that, we have many facets. Even in Germanium, we have they feel internally weak and judged for not meeting their expectations. Even in hypothymus, they feel mocked, laughed, and ridiculed. So these are the understanding why delusion criticizes them. Next rubric is delusion is despised. Yeah, appreciation for looks. Yes, ma'am. Yeah, they need for appreciation of looks. So whenever they're not valued, they're not appreciated, they feel they're criticized. They feel hurt about it. Delusion is despised. Despised is meaning is, please understand, despised is to be hated, to look down, to reject with contempt. And the key word is hated, looked down upon, and rejected with contempt. So the three keywords, whenever there is history or the patient says, I am rejected, I am being put down, I am nothing, then only we can think about the rubric delusion despised. So the person has a fixed inner conviction that others hate them, reject them, and look down upon them. They say inside the person feels I am not acceptable. People don't like me. I am inferior to others. This is the actual meaning of despise. So don't get confused. Now, the main key difference of criticized and despised. Anybody, doctor? I explained both. Any one difference? What is a criticism and despised? Any one key difference which you can tell me?
हम क्रिटिसाइज में उसे लगता है कि दूसरे उसे क्रिटिसाइज कर रहे हैं जबकि डिस्पाइज्ड में वो खुद को डाउन फील करने लगता है वो अपने को ही मतलब लो फील करने लगता है
Yes, correct, correct. और खुद को लो मतलब व्हाट इज दैट लो?
वो खुद को उतना वैल्यूड फील नहीं करता है वो खुद को वो उसे लगता है उसे उसमें खुद में कमी है जिसकी वजह से वो मतलब डाउन या हेट फीलिंग आ रही है क्योंकि उसमें खुद में कमी है
Okay, yeah. So criticism is more about performance. Okay, criticism is regarding performance. Despise is more regarding existence. Okay, so criticism and performance ke related, it gets criticized, but in despise is more regarding existence or rejection. Okay, the person is rejected and despised. How we can differentiate is feeling that others are finding fault in them. Focus is on actions and performance. Person thinks I am doing something wrong. I may be doing something wrong. Emotional state is anxiety and self-doubt, fear of being judged. That is there in criticism, criticized. Constant overthinking before speaking or acting, tries to avoid mistakes or seek reassurance, perceives others as judging or evaluating. Patient may say, people point out my mistakes, I feel judged, I'm not confident in what I do. But in despise, the feeling is they others reject me or look down. Others look down on me. The focus is on identity, okay, and self-worth. Self-worth का कोई मामला नहीं है इधर. This is self-worth, okay. Despise is more of self-worth. Person feels I am not worthy. Emotional state is hurt, rejection, and loneliness. So feels unwanted and not valued. This is the main feeling. Whenever the person feels I am not wanted as an identity and the worth, we can think of despised than criticized. Okay. Person perceives as other disliking or rejecting them. Patients say, people don't like me. I feel unwanted. Nobody respects me. This is the main key difference. Okay. Any doubt? So how does it despised have a journey? How they going to despise this? Initially, they feel rejected. They have already a soil for rejection sensitivity. They already have that feeling. I'm unwanted. I have a, whenever they don't consider me, I feel like they don't want me around. I'm nothing. Why do they want me? That is a feeling already the person, the constitutions will have. On the top of that, they will also have self-worth, low self-worth. Inside deeply, they feel they are very inferior. They don't have any feeling that I can do it. There is no self-worth. Confidence is not there. It's more higher than the confidence. Then the book mind goes into emotional withdrawal. They avoid people, not just out of fear, but due to expectation of rejection. Okay. Because of getting rejected, the fear, some people will not go to interview. Have you observed some men? They have the fear of being rejected in the interview. They can't take that. So they have the fear, I may be rejected, or they, as usual. So they stop going into interview. Okay. So such cases you can see why you're not going to job. So I had a uh, patient who doesn't like to go to job. Okay, when I asked what, he told me, what is there in going job? Anyway, they will reject me. What is there? So that kind of cases we can think this rubric according to the of course pathology, but these are the scenarios we can think about this rubric. Okay. Okay. Any doubt in the rubrics, doctor? Okay. We'll go to the next rubric. Delusion diminished is. Okay. Diminish means reduced, made smaller, lowered in value or importance. Okay. So if the patient, if there will be a feeling of incapability. Always remember in previous rubrics, there was no incapability feeling, but in diminished, it is smaller. What is smaller? You have a big bottle and a small bottle, right? So what is small? Small is the feeling that I'm less. I'm very less. I'm a very inferior person. I'm not big. That feeling is less capability, less important, less worthy. That there is fixed belief that they are reduced, inferior, less than others in worth, ability, or identity. For example, a person who's materialistic, when his friend gets a bigger car, okay, so he feels I am smaller. I have a small car. They feel that no, they are not materialistically, they are not great. They feel smaller. They feel diminished. That is the understanding. So they feel small in front of others, insignificant, not measuring up. There is inferiority, inadequacy, and loss of self value. How does this diminished state arises? The origin is from humiliation in childhood or in the workplace. Whenever there is history of humiliation, and then this goes on suppressing, especially in IT sectors, we can see many cases. There will be a lot of humiliation and suppression of that individuality, and this goes into being looked down. Okay, being always looked down, suppressing their identity, humiliating the worker, and this not being valued or recognized for their work. This has a delusion diminished feeling. Okay, this is the journey, or we can see the origin from these uh, emotions, or these are the criteria how this delusion diminished arises. Okay. Is also first initially they feel inferior, they feel deeply they are very less, constant because of comparison, boss comparing or workplace are comparing the other workers, and they feel inadequate. She is able to do the job in 1 day, I'm able to do that in 3 days. So they feel incapable, doubt their own abilities, and I'm not sufficient. That is a feeling that we always see such many cases actually. Whenever that, especially even in doctor field, it happens. Allopathy doctors seeing around 10-15 cases, but another allopathy doctor feels like I'm not able to even see 4 cases in a day. So that inadequate feeling we can see in the daily scenarios, because of which they lose their identity. Loss of identity is seen. Feels reduced as a person, sense of self becomes small. Yes, you lose a confidence. Na? Whenever we see many patients and cure cases, we get confidence. Otherwise, what do we feel? We feel we are diminished. We are small. We are nothing. He is a great doctor. So this is the feeling. There is a loss of identity and diminished. Okay. We have a remedy in this, a remedy which we see in the rubric, delusion diminished. Beautifully, we have a remedy of platinum. Okay. So can anybody explain how platina goes into the delusion diminished? Can anybody give an input? How platina is there in this rubric? Yes. How platina is there in the delusion diminished? Why it is there? Can anybody answer? Anybody knows the answer? Why platina? How platina is there? Yeah, but why it is in delusion diminished?
Platina thought that he's the princess, and all others are their slaves or something. So all are diminished, delusion diminished, all are diminished. That's, I think, is
Mm.
it
But
correct or
even platina feels delusion, she is diminished. Why that is happening? Why she feels the platina, why it feels she is diminished? That is my
oh, she,
question. Yeah.
oh, she is diminished.
She is diminished. That is a feeling of self.
Oh.
So beautifully, we have a platina, which is a in the other end. So there is a journey for the platina. Let us understand why there is superiority complex. So let us go from head to tail. You are telling why there is superiority in platina. So why the superiority comes? Because of the feeling of delusion diminished. Okay. So we will understand in platina why do we have this rubric? Why this remedy is there? So platina is a remedy of compensated diminishment. Please understand, whatever you're seeing the platina is not just outside we are seeing the superiority complex, but inner core, how does this delusion diminished is present, we will understand. Okay. Okay. First, platina, as I told you, in the beginning, in platina, there will be a feeling of crushed down, a higher force, a huge force or a higher authoritative person. Such type of force is being crushed down by the platina. Initially, okay, there will be a crushed down feeling, put down feeling to a platina. They will feel overpowered. They will feel humiliated and they crushed by something bigger. That is the initial stage. And they feel I am small, I am nothing in platina. Later, this goes in the mind, the platina thinks, I have to compensate this small feeling by showing and by growing bigger. That is a compensation mechanism. And to grow big, to have to survive this compensatory, to compensate this crushed on feeling, I will become big. So, how does it survive? It survives itself by becoming superior. Okay, inside they have got humiliated, they have got put down. But to compensate that feeling, outside it is showing I am big, I am superior, I act noble, and shows the pride. It is not true superiority in platina, what you say, it is a defense against the smaller inner smallness. Please understand. In this rubric, that's how the platina goes. The superiority mask inferiority. As I told, externally, they are haughty. Externally, they're arrogant. They look down others, as ma'am told. They put down. They see others very low. But internally, they feel inferior and they have diminished because they have been put down in the initial phases. Okay. Queen-like state. Why they behave that queen-like state? To feel, making feel they are special, they are rare, and others are ordinary. And they maintain distance. They don't talk to everyone. This leads to actually isolation and loneliness. Okay, they show outside, but they feel actually lonely and isolated. Fear of being diminished again. Why they don't talk to others? Why they reject people? Why they show they do talk to very few people? Because they have again a fear that they may again go to diminished feeling again. People may put down me again. People may humiliate me again, crush me again. To avoid this, they go into they don't talk to others. They will have a fear aspect because of which they don't talk, and because of which they go into superiority, they take control, they go into the distance. Okay, so if I don't remain great, I will become small again. This is the thought process of Platina. And last, she does not become the Platina does not become big because she is great. She becomes big because she felt once she was small. So the Platina had felt once it was a small, it was being put down. To compensate that, it is showing a bigger picture. I hope you understand. Okay. So this is the actually the Platina understanding. That is why it's in the rubric. Okay. So what kind of pathology do you feel you can get in this? And small diminished. What is the GNM understanding? What is the feeling here? Biological correlation. Now connect the mind to body. Now inside she's feeling I'm small, diminished or diminished. Yeah. I must grow. What does the body respond? If the mind is having this feeling, how does the body respond? Anybody, doctor? It's very easy. You have to think opposite. I'm small, I'm diminished. So how does the pathology comes? Here superiority complex makes them feel even smallest priority is given. Yeah, correct, Dr. Slat. Yes. Loss of positions in that. Yeah. And they feel they are higher. Yes, these all are external aspect. But internally, this is the feeling. So the mind thinks I'm small, I'm diminished. The body says I should grow, right? So opposite. Whenever the mind tells I'm small, I'm diminished. So pathology, what we see. Anybody?
Microcephaly या
Humor,
encephaly.
growth.
Hmm. So the delusion is I am small. So to compensate this delusion, what does the body grow? How does the body show it?
Growth, any growth
Huh.
in the
Yes, yes. It's a growth.
pots or
Yes. Yes.
Growth,
What?
growth.
Correct, doctor. Yeah. So mentally, because I am low, I want the body should show, no, I am a big one. The body will compensate its mechanism by showing the growth. I'm big. Because I am inside, I'm feeling a small. I'm feeling low. I'm feeling, inferior, diminished. So the body shows hypertrophy, overgrowth, thickening, swelling. Even you can think like insecurity. Whenever there is insecurity, we can see a growth, right? Even here, this is insecurity. This is a type of insecurity, a diminished feeling, right? So we can see hypergrowth, hypertrophy, overgrowth, thickening, swelling. Inner smallness is outer expansion. Even in pathologists, we can understand like this. Okay. In delusion diminished, yeah. In delusion diminished, the person feels small inside. And the remedies like Platina show us how the system tries to survive by becoming big outside. So whenever you see a Platina, the journey you understand. So that is why they behave like that. They directly don't go into that delusion. Because of the journey, they go into that delusion. Okay? Yeah. I hope you're clear with the delusion diminished doctors. Any doubt? We'll go with the next rubric. So these are the rubrics which we are going to understand. Okay. So before going to these rubrics, okay, I have a small announcement as we are conducting the clinical correlation online workshop, which will be there in the next month. Okay. We were bridging the gap between the theory and real clinical practice. We all know we have a knowledge and we do understand how to take case and also apply it, but when it comes to apply it, we have a confusion, okay? Because the theory is there, we are having a lot of knowledge, but when it comes to clinical application, we miss out. We don't have the clinical success. We do understand we have to take this rubric, but when to take, what to take, a clarity is not there. So whenever we get a clarity, we do understand, even in prescriptions, we get clarity. So that gap, we are going to understand what is missing in that gap, and we are going to give it. We are going to make you understand to fill the gap. When we fill this gap, we will have a structurized knowledge. And whenever we get a case, we are able to apply it organized way. Okay. So in this workshop, we are going to understand the clinical approach in a structured way. See, all we have, you have attended many clinical sessions. We all know that, even we are attending, but the sessions what we are conducting now will be an orderly form. Whenever the brain organizes the information correctly, we are able to apply it beautifully, right? So you are seeing an organized way of teaching in our academy. So even in this coming workshop, there is an organized way. You will have a clarity when to take what rubric. So this clarity we are going in this workshop. This is not about only information, but we can apply it very nicely. Embryology was very important in understanding the germ layers, right? We also saw now they are confused between old and new mesoderm. But when you get cases of pleura, pericardium, we are not able to understand whether we have to take an attack conflict or we have to take a self-devaluation conflict. We will have an understanding when you attend these workshops. Okay. And this also in genetic and deep pathologies. Whenever you have a deep pathological cases, this is very, very, very useful. Even when you attend camps, wherever you can attend camps, if you have this knowledge, you will be able to understand and apply the rubrics. Though your organ important is very crucial in case taking. So that is why we have added this in this coming workshop. So don't miss out on this. And even acute and emergency approach, we are understanding how to convert patient's language into pathological rubric. And also whenever there is no expression of the patient, we will be handling such cases without even patient telling them by its observation or the reports. Okay, that is more important in nowadays clinic, because nobody can tell you everything when they are admitted or whenever they are not able to tell. Only that reports can help you. Reports don't lie, body don't lie. So we are understanding how we can crack the cases with reports. And syphilitic cases, where to focus on mother's history, where to take the entry rubric, where to take the GCS, and where to take pathological cases. These cut and clear, okay, topics will be dealt with. Okay. So when we understand this clarity, it becomes easy in cases and clinic to take such, cases. We get confidence to crack such cases. Even GNM understanding. GNM, see, GNM becomes a tool for case taking. Without understanding GNM, we cannot attend any sessions of predictive, or it could be in any other homeopathical aspect. We are not able to understand the function of the organ, right? So GNM gives a correlation of that, so it becomes very easy for probing the case. You get a PCOD case, you get a case of infertility. That cases which are very difficult to treat becomes very easy when you know the conflict. Okay. Autoimmune diseases, we should understand what is autoimmune diseases, what prescription should be given, and also when to take this confusion cellular concept. So confusion identity rubric will be understood in autoimmune diseases, when to take it. Okay. So PCOD and female disorders. This is a common cases which we get in clinic. When we understand these cases and able to give result, we will be able to take the homeopathy to the next level, because we have a lot of scope in such cases. So we are added fibroids, adenomyosis, menopause understanding with cases this time. So don't miss it out. You will also have understanding of dealing female cases, especially female doctors. Please do enroll, because we have a lot of scope in this. Okay. There are a lot of hormonal treatments going outside. We can all avoid it whenever we have knowledge regarding these disorders. Miasm. So we are seeing how miasms are evoluting, right? Evolution happening. Even in the Medramedica series, coming Medramedica series in this workshop, we are going to understand Sora psychosis syphilis. Without this, we cannot understand the remedy or the case. Please understand, because if you don't understand the miasm, we cannot prescribe. We cannot take the rubric after the miasm. Okay. This delusion and delirium becomes very crucial in, especially in acute pseudosyphilitic cases or psychotic cases, when to take delusion, when to take delirium. That clear understanding, we will be understanding that clearly with cases, and also the expressions of the patient. And in acute and emergency condition, what rubrics we can think, that will be given in detail of delusions and delirium. Okay, Meta Medica. Even this is there. Whenever we understand a remedy, we are going to understand its miasm along with the patient journey in the workshops. Group study. We have added few groups this time, which will help you in understanding and differentiating the remedy. So we come to the rubric, we take analyze, and but we are not able to differentiate the remedy. So this clarity you will get after this session. Okay. So Ering's law also. So many people know what to consider now. When we understand the embryology, we also understand how Ering's law of cure takes place. So whenever we have wrong direction of cure, we are able to antidote and take the right remedy again, so that the patient doesn't land up in more severe clinical disorders. That is why this becomes very important. And even permanent cure, what we seek in organ and aphorisms, okay, that all that understanding with clinical case taking aphorisms, which are clinically apt, which we are already dealing with it, but we are not applying completely, that we are able to understand and guide you. That we will understand in coming workshop. Each aphorism applies, how we use it daily clinical practice. Even we are not completely applying it. So when we try to completely apply it, so we get beautiful results. So that we are going to teach you. So that I think it's lot more in this workshop. I don't think anybody can give you it in a very packed under one roof. So these are the previous workshop testimonials, you can go through it. So many people have understood, even if they have not attended other clinical workshops, by attending this they have got a clarity regarding how to take case, how to apply GNM. These are very important in getting results in clinic. Okay, so please do go through the testimonials. Okay. So this time we have actually added a feature where the recording will be provided. So the 7 days access will be there. We are paying for the website for what the recording will be available for 7 days. If you're not able to attend it live, you can go back, and 7 days you can learn all the sessions, and you can note it down, make notes. So that is the beauty this time we have added, and we have kept it for very lower price. Actually, it was 5K we had decided, but due to homeopathy day month, we have reduced it 1,000, and also we even reduced another 1,000 rupees because we are giving clinical mastery series. So we are charging 3,000 to 2,999 without recording. If you are able to attend live, you can pay this and attend live. If you're not able to do it, you can pay now 3K to 999. But if you missed out, if you couldn't attend the live, you can pay extra 299 and take the recording. For next after the sessions, 7 days you will have an access. Okay. So any doubts, you can contact us. What all we are covering, we have already put it out. But if you have any confusion regarding the workshop, you can definitely contact us. Okay. Yeah. Even if you miss one session, doctors, you can get the recordings of all the 4 sessions. Okay. I hope you are clear. So you need not pay advance any amount for recording. If you're not able to attend, you can pay. Okay. Yeah. Okay, doctors. Okay, ma'am, on which platform will lecture be conducted? It is Microsoft Teams, doctor. It's very technically good, and you will not have much glitches. So we are going with Teams. Okay. Next, delusion one is dirty. Okay. Yeah. Okay, we'll go with the next rubric. Delusion one is dirty. As I told, there are 4-5 rubrics more. We will understand how the patient tells, and I have few clinical experiences I want to share. So delusion one is dirty. Dirty means impure, contaminated, and unclean. It is a felt sense of impurity. Remember, it's impure. This impurity can be physical, moral, emotional. Physically, the person feels that my body is unclean. Morally, I have done something wrong. Emotionally, something is wrong with me as a person. This is the emotional. Okay. The person has a fixed inner belief that they are unclean, impure or contaminated, even when they are actually clean. Okay, so there is a thought that physically I am unclean, morally I've done something wrong, or emotionally I am wrong. So something is wrong with me. So that is the thought. So the person has a fixed belief that they are unclean. Already they have a convincing belief. Okay, so it is an internal self-devaluation state. Remember, these are the feeling. There is a shame, there is a guilt feeling, and there is self-disgust, because of which there is a delusion one is dirty, which is formed. Without the feeling of shame, guilt, self-disgust, you cannot think of this rubric. Please understand. Whenever there is feeling of shame, some religious shame, okay, a religious person who's gone into this, they got encountered with something, very uh, bad, or something, guru, which he felt he did something sin by touching a lady. That's nothing wrong, but he felt there is shame, there is some guilt, I did wrong. So this facets will tell you delusion one is dirty. So what are the origin? How does it originate? This self-devaluation is childhood conditioning. So since childhood, they would have told, "ಈ ತರ ಮಾಡ್ಬೋದು." Yeah, you should not be like that. You should be like that. There is a harsh upbringing. There is shaming for natural behaviors. So, for example, the child urinates out of fear, or something, he would have made himself dirty by playing in some mud, or something, he would have played a holy and he would have made himself dirty. Such simple behavior where they put down, they tell, you are dirty, you should not be like that. A very harsh, a strict upbringing can lead to such thought, saying that you are bad, you are dirty, you should be a good child, you are a bad child. And sexual trauma or abuse, any strong imprint of contamination, like saying before the marriage or after marriage, having such sexual encounters is a sinful. Okay, a guy, even showing your face, some women feel that even showing my face before the marriage to, the other guys, it is a guilt, it is a shame. So such religious moral belief, sexual trauma, even abuse, any history of childhood abuse, they feel they are impure. Any rape cases, childhood, abuse, elder person abusing a child, touching inappropriately, inner feeling of the child feels that I am contaminated, you know. And also there is a religious and moral guilt, as I told you, strict belief system. In my religion, I'm not supposed to do this. Okay, otherwise I will be considered as a sinful person. Some natural desires, for example, in getting a libido, feels they are sinful, it's a bad thing. Okay, these thoughts make the feeling of impure. And moral injury, what is moral injury? So did something against own conscience. So I did something which has hurted them. I cannot forgive myself, or forced into some situations. Okay, something like moral injury. I hurt them. They would have done without the intention, but they feel, because of me or because of my moral, I have hurted other person. That conscience is what gets affected. Clinical expressions are excessive washing, bathing, repeated hand cleaning, avoid touching or closeness, social withdrawal, low self esteem, feeling unworthy of relationships, excessive religious ritual for purification. I think many people would have encountered some or the other people in your life who are always washing their hands, or in the clinic, always using the sanitizer, using their towels, or using chappals, always using the soaps. You get the sanitary soaps. All these behavior we should observe and ask them why you are doing it. You should probe them why you are doing this repeatedly. So I had a case 2 weeks back. It was acute case of hiatus hernia, and she had severe gastric issues. So she was all treated for that, and she had come for a little bit issues with hearing headache and some hearing issues. She had some tinnitus issue, and also uh, she had little bit right side hearing issue. So she told me one thing, since a week, I'm feeling my hands are very dirty. I need to be repeat. I don't know. I feel like washing my. I feel my hand is not clean. I don't know why I'm being clean. I feel something, unusual. She's only feeling. But here you cannot take this rubric here. Okay. These are the rubrics which the patient only doesn't know that they are excessively washing. They are unaware of the situation. Okay. Here, when the patient says like that, you cannot take that. Okay. You have to ask them why you are doing it. If they say I'm feeling dirty and my hands are not clean, then you can think of such rubric. But if they don't say, you can understand they are excessively washing by their behavior itself. You can take such rubrics. You need not ask because patient will not understand they are doing it. Okay, patient feel I feel unclean. I don't feel pure. I don't deserve good things. I feel ashamed on myself. Okay, these are the expression. So Dr. Shreyans had explained you lack caninum understanding in the remedy, right? So here also I want to explain you how this rubric matches with this remedy. Okay, one is dirty. Okay, initially in lac caninum, there is a deep inferiority and comparison. As I told, as Dr. Shans has explained in video, there is a lot of inferior and compare feeling in since childhood. This origin of dirty feeling, I am inferior, I am bad, I am dirty, originates in the childhood itself. And then the inner conflict is no matter how much I try, I am still inferior. That is why it's a lack caninem. Okay. How much ever they try, they feel they are inferior. They are worthless. They are looked down. Why? Because of the dirty feeling. It is in the soil because of the constant comparison and inferiority. I am still inferior. Emotional state says there is a feeling of degradation, self-disgust, and self-contempt in Lacananum. That is how the journey goes in Lacananum. At the end, dirty feeling comes from rejection and comparison. As I told you in previously, how the journey goes. Rejection and comparison. That is how you go into the delusion dirty. Because in childhood, they would have put you down. They would have told you are bad, you are impure, you are rejected. Because of this, there is feeling of delusion. One is dirty in lac caninum. Okay. But when it comes to syphilinum, it's a remedy, no remedy. It has a deep destruction and hopelessness feeling. It doesn't have all this inferiority comparison. They have a destruction. They have a hopelessness. And this origin of dirty feeling comes from inherent quality of contamination. Even their mother, even the father, even in generation, they will have that inherited contaminated feeling. That is how syphilinum is differentiated. There is fear of contamination, strong fear of infection. They keep on washing the hand. You should ask them why. When they say there is fear of contagious diseases, we can think of this remedy. Fear of spreading impurity. Behavior is repeated washing hands, repeatedly cleaning, rituals. All these are syphilinum understanding. Also, there is dirty feeling which comes from internal decay and inevitability, but doom. Okay, so the understanding is in syphilinum, how much ever they clean, they have an always mind that I'm going to be, infected. I'm going to get some disease. That is a thought. But no, lack and venom is a different. There will be rejection and comparison. Okay, I hope both are clear. In delusion, one is dirty. The person does not feel less; they feel impure. Okay, and the reason behind that is impurity defines the remedy. They do not feel less in dirty. They just feel impure. And the reason you have to probe why they feel that. That becomes your remedy. Okay. I hope you are very clear. Each and every rubric is very clear. Any doubts, you can definitely ask me. I will understand. I will make you understand. Okay. Can you give a thumbs up if you have understood? I'll go to the next rubric. Yeah. Thank you. Thank you. Okay. So delusion disgraced. So before me explaining, can anybody give an idea? What do you mean by disgraced? We saw despised, criticized. What is disgraced? All are very close rubrics. What is disgraced? Graced. Anybody? What is the rubric meaning? Disgraced.
Worthless. Something.
Okay. What aspect should be there to take the rubric disgraced? What is the key aspect which has to be there, the element to take the disgraced feeling? One is respect, reputation, very good. When there is reputation lost, whenever there is respect loss, then honor, public humiliation, all this. Okay. So I will tell you. Disgraced means loss of respect, honor, or reputation due to one's action, or due to public humiliation. Even two things. Either my own action or the public has humiliated me. Because of that, they can go into the disgraced feeling. So it carries shame, dishonor, and public exposure. I have been exposed. I've been exposed. I've been caught outside. They have told about me in front of everyone. It's gone. I am gone. My reputation is gone. I lost my respect in front of others. The person has a fixed belief that they have been dishonored, humiliated, or have lost their reputation, even if it is not true. It's not happened. That is why it's a delusion rubric. But they feel it has happened. They feel they are exposed, they are ashamed, they are socially fallen. So it's a remedy, should be a social position concerned remedy. Remember this because there is social aspect here, society aspect. Okay. The inner feeling here is there is a deep identity self-devaluation. Okay. They have put me down, they have disrespected me. Inside, that person feels I am not respected anymore. I have fallen in others' eyes. I have disgraced. For example, we see in many movies on political parties in village, right? So they would have done many things for the village people. After that, one point of time, they get, they put allegations, some other party, or they would have put him, the political person in a spot, saying that this guy has cheated the village people. Okay, and he has shown the good face. And even people believe that. And that becomes a public humiliation. If such incidents and that person loses the honor, respect, we can think of delusion disgraced. There is intense guilt, shame, embarrassment, self-condemnation. Okay, self they feel I'm not my respect is not anymore in this village. Mine is gone, and out of respect, they go into suicide also. There are many people who are having an respect, honor, uh, personalities. They go into that suicidal tendencies. How does it originate? First is it could be a public humiliation, scolded in front of others, insulted publicly, which has caused a deep imprint. It could be even accusation, scandal, as I told you. In politicals, there'll be a lot of scandals, false accusation, or being caught in something. My image is ruined. Right? So if you're a very good political party, you're in a very good VIP position, and you are put it in a scam, you're caught in a scam. So what happens? They feel you are wrong, you are some wrong personality to rely. So their reputation gets lost. Childhood experiences getting punished harshly. I've seen many movies, even in many movies they have shown that in childhood they get punished very harshly, so that get shamed repeatedly. So moral conflict also did something against own values, feels unable to forgive self. So being plotting a murder, going against the conscience of the person. Such thought process, such conflicts can give rise to such delusion, what you call disgraced. Patient expression is I feel ashamed. I have lost my respect. As I told you, I can't face anybody. I can't face anyone. I feel embarrassed even now. People will think badly about me. This is the thought process. Being disgraced means the value. Grace, it means the value. The value is being attacked. So biologically, we know that the mesoderm structure, bones, joints, connective tissue gets affected because my structure value is shaken. Do understand? Whenever the value comes in cases, we see that there will be affinity for joints, bones, connective tissues. So we have to take the rubric pertaining to value. So this is the rubric pertaining to value. Delusion disgraced. Okay. We have few remedies. I will explain the core feeling. You can go through it later. I will share this photo. Okay. In Natrum self, we have a core feeling that I am insulted, not valued by a person who matters to me. Strong focus on relationship based humiliation. Feels hurt when not appreciated by important people. Needs recognition and emotional validation. So, to compensate this, they try to prove their worth working harder. Okay. So, they seek that appreciation and they even go into the delusion disgrace comes from not being valued by significant people. So in Natrum self, it's more of a duty and a love bonding remedy. Okay. So whenever that is not there, not appreciated, Natrum self element not appreciated, they go into this disgraced by the loved ones or the close ones. Okay. Sulfur also, I told you. They have that feeling that I am insignificant, I'm not recognized. You know, though, sulfur is a person who needs to have a recognition, who has to get the appreciation, who needs to, be in the limelight. But if they don't get that, they feel that they have to prove their importance. So they go into disgrace because of feeling ignored and not acknowledged. Kali self also, they have that insulted feeling, I'm not supported, feels pushed aside within the group or family. It's a Kali is a family remedy. So whenever there is no support from the family, they feel degraded. So they need that acceptance and inclusion in the family. Whenever that goes, so Kali self becomes disgraced from the lack of support and belonging from the family, also from the recognition of the family. Platinum, even Platina is there in the disgrace. How? They feel that they are humiliated and I must rise above everyone. That is the Platina feeling, as I told you. Deeply innerly crushed, diminished feeling is there. And because of this, they compensate by becoming superior, pride, nobility. Even a small insult is taken as a deep humiliation. You could have seen Platina cases, how they react. They become haughty. So this delusion disgrace is transformed because of the exaggerated superiority. Okay, the disgrace is transformed into exaggerated superiority. Okay, this is outshone in a different way, but they have the feeling of delusion disgraced in the code. Do I understand? Hope you understand. It's in the code. It is not shown outside. Yeah. Delusion, everything will fail. Can anybody give input regarding the everything will fail and how it is different from delusion one is failure? How it is different? Anybody, doctors? Delusion, everything will fail and one is a failure. Delusion one is a failure. This is a very important rubric. This and the delusion one is failure. You always get confused. Anybody wants to give a differentiation?
E- Everything will fail is it is an anticipatory rubric. If
Yeah.
one is a failure, they are already decided.
Yes. Yes. Correct, doctor. One is failure is what
One
is
is
one is
failure
failure?
is they have already decided they are failure. Whatever they do, this is just they are futuristic. They are just thinking that they may fail, and they say that negative things about that. One is
Yes.
failure. They have accepted it. They are not going to
Yes.
try.
Yes. You are right, doctor. You're very right. There is more understanding regarding this. I will explain you in this. So, as ma'am rightly pointed out, it's a fixed anticipatory belief. It's a futuristic. Everything will fail. And whatever I do, I will fail. That is an anticipatory pessimism, a negative aspect. Fear of outcome, lack of confidence in effort. So they will put effort, but they feel that whatever I do, I'm going to fail. Everything will fail. No matter what I do, it won't work. Have you seen patients saying this? No matter how much I work hard, I'm not going to crack NEET. I'm not going to crack the, competitive exams. These are the facets when you can understand clinically expressions, avoids exam, presentations, doesn't try new opportunities, starts but does not complete. They don't complete. They started, but they don't complete because they have a fixed idea that it will fail. Because why I try if I'm going to fail anyway? This is still future oriented. So, not yet identity collapse. In this, we don't have an identity aspect here. Please remember, it is still about the outcome. Okay? Remember this slide? But what is delusion? One is failure. One is failure. They are sure they are a failure. Yes, correct, doctor. So, in this, a fixed belief, I am a failure. Deep self-devaluation, loss of self-worth, hopelessness is there. I am fundamentally incapable. So whenever the patient clinically withdraws, gives up easily, they don't attempt improvement, doesn't attempt the improvement. Next time they don't try. One time they try and leave it. Such personality, they withdraw from every, challenges. There is an acceptance of failure as identity. So here, delusion one is failure is an identity rubric. Okay, identity facet is there, but here everything will fail. We don't have an identity. It's an anticipatory belief. Okay. This is a difference. This everything will fail. One is failure. Please go through that. I will be sharing this uh, page in the slide in the group. Okay. Delusion legs are cut off. Okay. Okay, doctor. What do you mean by legs here? What do you mean by legs? What does legs represent? This is a more important rubric here. We do take this rubric in good cases, autoimmune cases also in PCOD cases, many cases we have. Performance, okay? Apart from performance, is only performance? Yeah, performance is right. Performance, then what does it represent? A symbol of leg.
To move forward.
Yeah, correct. To move forward. Then what does it represent? Movement, one is right. Going ahead in life, right? Then with leg, what can we do?
Stand on your own legs. That
Mm.
becomes a person's
Patient comments. Yeah, you're right.
capability or worth.
Yes, correct. So you can stand on your own leg, self-support, independence, then moving forward in life, movements, independence, very right. All these are facets. And ability to stand on one's own leg. Am I right? All are correctly, rightly told, all these points. Independence, yes, all are right. Hmm. In simple words, my capacity to move, act, and stand independently in the world. This aspect, when this gets affected, we can think of this rubric. Okay. So delusion legs are cut off. Cut off means completely separated, lost, no longer functional. Okay, completely cut off. There is no function. There's no more connection. There is this separation. Even it comes under separation conflict. Okay, the person feels they have completely lost their ability to stand on their own and function independently. They lose their capability. They cannot stand. They cannot take decisions. They cannot go to a place and make communication. They have to depend on the other person because they have lost the ability to function independently. Okay, when that is there in the case, we can think of this rubric delusion. Legs are cut off. It is a total dependence state, as everybody rightly said, independence. Legs represents, if legs are independence, then legs cut off is loss of independence. Remember that. So there is loss of confidence. There is loss of self-reliance. So as I told you, actually there was a case of Vitan sir. You can go through in his books. When you have attended his session, it was a beautiful case of PCOD. He had given Baraita card for this. like delusions like cut off. In that way, the case he explains that the girl who was in relationship, it was a toxic relationship. Okay, so in her home, they had already seen a alliance. So she could not go and tell to that person to leave him. Okay, she wanted somebody's support for for taking that decision and taking her to the ex to leave to do a breakup. Even for that, she's not able to go alone, do things alone. She needs somebody. She was taken the other person, her friend, along with her to go and do a breakup or to cut off that relationship, to cut off that toxic relationship. She could not take the stand for herself. Even in Rajan Shankaran, there is a rubric explanation of delusion legs cut off where the patient was completely dependent on a neighbor for all the activities of life, all the activity. You can go back to Soul of Remedies. He says this, the neighbor once, the patient's neighbor, once he expired, this lady got with arthritis. Okay, so he had taken the rubric delusion legs cut off because the total dependence of the patient was on the neighbor. When the neighbor went away, okay, so completely she was not having a person to rely upon, and she ended up with arthritis. Okay, so this is one understanding of delusion legs cut off. Okay, if you have any cases, doctor, please do share in the group of the rubrics, whatever I have, uh, explained you today. I hope I'm clear. So how this delusion legs cut off goes. So I cannot manage on my own. These are the feeling how the delusion legs cut off undergoes in life. Initially, they will not have a feeling of loss of self-reliance. It will start with helplessness feeling when they cannot manage on their own, and then they depend on the people whomever are there for support, for daily functioning, for decision making. They depend, and then this repeatedly goes, and they lose the control over their life. They cannot control their life anymore. They will ask the parents, or they will ask their friends, what should I do? Should I take up this job, or should I leave the job? That level of loss of control will be seen in the patient to take this rubric, and then there will be fear of independency. They have fear to take decision independently. They have fear to go job and do task alone. That time we can think of this rubric, and because of which they avoid responsibility. You can't avoid responsibility vaguely. You have to always ask why they avoid responsibility. Okay, when you get the answer why they avoid responsibility, that has to be taken as a rubric. Okay, that you understand. You cannot take the aspect of responsibility, why they lost the responsibility, why they don't want to take responsibility. That is because of delusion legs cut off. Okay, that should be taken as a rubric. So why this happens? Why this delusion legs cut off? Why does this happen? So because of certain incidents in life, okay, certain traumatic experiences, some separation, some death of close person, as I told you in the clinical scenario, no. So whenever there is losing of close person whom you were dependent, loss of guider, mentor, that person was a supporting leg. So loss of the support system. Then over dependence in personality, always relied on others. They never have developed the self-reliance. You have seen many kids, they even don't know to, make a coffee or a tea. Completely, the mother would have pampered the child and completely made them dependent on everything for mother, even husbands. I think you have seen many movies where the husband completely depends on the wife for each and every single thing, even for his own, items. He completely depends on the wife. So these are over dependence personality and sudden responsibility. Forced to take the responsibility, feels incapable, and then goes into emotional or social isolation. This is how the journey goes at deletion legs cut off. There will be no one to lean on, and because of which the disease or the delusion sets. Okay. These are the words what you can see from patient. I cannot take decisions. I can't feel, supported. I cannot manage things on my own. I feel I will collapse if I don't get stopped. My support is gone. I cannot stand anymore. This is this. In delusion next cut off, the patient is not just unable to walk, they feel they cannot stand in life without support. I hope you are very clear, doctors. This is the gist. Delusion not appreciated. Appreciation means recognition of one's value, effort, or presence. Whenever you're not appreciated, the person feels, no one recognizes me. My efforts are not valued. I am ignored in spite of doing so much, especially in the job, in IT jobs, many jobs, when the employer is being doing work but not getting appreciated. A fixed belief that they do not value, recognize, or appreciate them even when it may not be true. So, need for recognition, sensitivity to neglect, and dependency on external validation. So, we have many remedy, calcarea sulf, palladium. As ma'am also previously told, they need lot of appreciation to maintain the self-worth. They have to be told, you look very beautiful. Appreciation externally, they need that. And they need appreciation in their work. Okay, they have to be feeling always confident. If appreciation is present, they feel confident, superior, and complete. If appreciation is not present, they feel collapsed. There will be lot of hidden insecurity, dependence of recognition, and sensitive to neglect. Whenever these aspects are there in the patient, they need that appreciation. Then they feel sensitive to be neglected. We can take this rubric, okay, and with hidden insecurity. Okay. Okay. So there is another two rubric, doctors. So delusion ugly and delusion wretched. I hope you are clear with all these rubrics. Okay. Even this palladium case, there was a small case of 15 years old PCOD case in my clinic. So she was excellent in studies. She was a rank holder. Also, she was being put up in a boarding school where other aspects of, you know, uh, cultural activities was given more important along with the education. She was excellent in both, but she was very silent. She was like a platina, but we thought of platina met, but we were not able to conclude it. We also saw in palladium, and she had a right side ovary PCOD. Yes, we know palladium is a right-sided ovary affinity remedy. Okay. Also, she was behaving like a metal remedy, very, very egoistic. She wanted that appreciation. She was telling openly, I am doing so much. I am excellent. I'm a rank holder, but people don't recognize me. So we took delusion, not appreciated. And palladium with pathological rubric of right cyst ovary. We got palladium. And I think we'll be sharing that case in upcoming workshops. Before and after, beautifully she has recovered. The PCOD has gone within 6 months. Okay, so such cases will be dealt in the workshops. Please do attend. And before concluding my session, I have one last rubric to differentiate. Okay, I want doctors to answer what are the differences between delusion ugly and delusion wretched. So there are two aspects, right? Delusion wretched she looks and delusion ugly. What is the difference, doctor? What is the difference? Can anybody tell in one line what is delusion ugly and delusion wretched? The last rubric of the day. Yeah. What is delusion ugly? The word itself says ugly. Ugly means anybody? Doctors, are you there? You can finish it off. Ugly? Yes. Yes, ma'am. Yeah, you can see and tell. Not good. Yes, ugly about how they look. Yeah, it's more of external beauty, right? Yes. Yes. Anybody of you can see and tell. So the core idea of ugly, it is not external. If the person has a fixed belief that their physical appearance is ugly, deformed, or unattractive, that is the meaning of delusion ugly. So the level is body image, just an external focus, how one looks. They feel there is something wrong with physical appearance. They should look pretty. That is the core. This is superficial. It is just limited to appearance. It could be kind of shame feeling, self consciousness, embarrassment. Okay. Thought pattern could be I look bad, my appearance is not good. People will notice my defect. That is a feeling. Behavior could be they avoid mirror, they keep checking their face. Okay. They keep hiding, putting pimple patch. That is all the behavior. They hide the appearance, social exposure, and they put filters. Okay, all that. Clinically, they could be having a social anxiety, a simple pathology. Okay, not too much. Essence is just an appearance, but enriched, they completely feel miserable. They feel ruined. It is a whole complete personality. Okay. It is not just about external beauty. They feel as a whole human being, as a whole person, they are ruined. So it is an internal and global whole life and existence is gone. Okay. Identity level of rubric. This is an identity level, delusion bridged. Entire sense of self is affected. It is a deep rubric and it affects entire personality. There will be hopelessness, complete hopelessness. Here you can't see hopelessness. You see in daily cases, no, they say I'm ugly. It's a lower rubric. Wretched is a higher rubric. Okay, complete hopelessness, emotional exhaustion, self pity. They say my life is miserable. I look pathetic. I am ruined. That is okay. Withdraws from life, loss of interest, reduced engagement. These are more syphilitic aspect. Understand that this is more syphilitic. Depression like state, low vitality, existential suffering, problems in entire existence. This is a complete existent problem. This is not existence. It's a superficial appearance. I hope you are very clear. Feeling awkward about oneself. Yes, very correct. So complete personality is wretched, only appearance is ugly. I hope you are able to differentiate it. Okay. So even the remedies, yeah, remedies there. Right? Okay. So when you go to the rubrics, you have both remedies are totally different. You can go back to the repertory and you can check. Okay, you have completely different remedies here. Please do go to the repertory section. Whatever you have understood, start applying in cases and share it in our group. We will also learn. So thank you for today. And we have our own channel in YouTube where we are posting very good videos and you can go back and learn. Even we have groups where we have discussions. Please do attend the discussions, and our Instagram channel where we put our testimonial cases. Please do watch. And thank you for today's session. And please enroll as soon as possible, as the last date is on 30th April. We have hardly 2 days. So please do think about it. And the session, what you're going to attend, will be worth it. Yes. So thank you, everyone. As we come to the end of the today's session, so successfully we have completed 4 sessions of clinical mastery series. I would like to express my grateful, heartfelt gratitude to each and every one of you. So your consistency, the patience, and your interest in learning, the interaction, attending all these 4 sessions shows your dedication, commitment towards the system. So I sincerely hope today's session has been impactful and has added a real clinical value, something you can, start directly applying in your cases, clinic. And I sincerely hope today's discussion has been very impactful. Your support and enthusiasm, is encouragement to us and you to continue the learning academy and creating more such meaningful sessions, and looking forward to seeing more of upcoming clinical correlation online workshop. All of you, I request and also I encourage you to join that, and we'll all meet there and have a great discussions in as well as in Metra Medica series where Pavitra ma'am is also collaborating with us. You have a jam-packed cases with Metra Medica remedies. So when you don't have time to sit and study, please do join even a clinical workshops and series where we have all combined the knowledge and giving you very, very, very in a very systematic and organized way, which you will able to organize in the brain and apply. When we study, it's not organized, but when we learn, it's all organized. So I hope, today was beautiful evening. So thank you all for once again making this entire series a success. See you all very soon. Thank you. Thank you, Pavitra ma'am, for joining and giving your inputs. Thank you, ma'am. Thank you, senior practitioner, Dr. Anita ma'am, and other Dr. Sadhana ma'am, Dr. Nitya, Dr. Archana, Dr. Pooja for giving an input and interacting with me. Thank you so much. Thank you.